Hi, everyone, and welcome back to Field of Vision with me, Nikki D. This is the podcast where we talk about everything glaucoma. So, if you are new to glaucoma or have been living with glaucoma for many years, this is the podcast for you. I have been living with glaucoma for over 25 years. I am a glaucoma patient, but also have worked in the medical field with glaucoma patients. So, I am here to share my journey with you and help answer any questions that you may have about your glaucoma journey. So, today we're going to talk about something that many glaucoma patients experience but don't always feel comfortable talking about, and that is side effects from your glaucoma drops. The information shared in this podcast is for educational and informational purposes only and reflects personal experiences and perspectives. It is not intended as medical advice, diagnosis, or treatment. Always consult with your ophthalmologist, physician, or qualified healthcare professional regarding any questions you may have about your eye health or medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. So in our last episode, we went over everything about glaucoma drops, why they're used, what types of glaucoma drops they are, and how to use them. And today we're going to dig a little bit deeper into that. So if you have been prescribed drops to lower your eye pressure, you may have noticed things like eye redness, irritation, dryness, or other changes in your eye or both eyes. And when those things happen, it can be totally frustrating. You may wonder, is this normal? Is the medication hurting my eyes? Do I have to live with these side effects forever? So, in today's episode, we're going to talk all about why glaucoma drops are prescribed, the different types of drops people may use, common side effects, patients' experience, ways to help reduce those side effects, and important reminder, doctors often adjust medications if something isn't working well for you. Most glaucoma treatments are designed to lower intraocular pressure or IOP. Lowering pressure helps protect your optic nerve, which is the structure that glaucoma affects. The optic nerve is responsible for sending visual information from your eye to your brain. When the pressure inside the eye is too high, or sometimes even within normal, quote unquote, normal range for certain individuals, it can place stress on that nerve. Glaucoma eye drops work either by helping fluid drain out of the eye more efficiently, reducing the amount of fluid the eye produces, or sometimes doing both. For many patients, drops are the first line of treatment, and these can be used successfully to help manage glaucoma for many years. So there are several main categories of glaucoma medications. One of the most common is prostaglandin analogs, which help increase fluid drainage from the eye. Examples of this include xylatan, Lumigan, Travatan Z. Another group is beta blockers, which reduce fluid production inside the eye. And a common example is timolol, and another brand of that is optic. There are also carbonic anhydrase inhibitors, such as dorzolamide or Truzopt and Azopt, which also help decrease fluid production. Another category is alpha agonists like alpha-GAN P, which work in more than one way to help reduce pressure. Sometimes doctors prescribe combination drops, which contain two medications in one bottle, such as Cozopt or Comagan or Simbrinza. Your doctor chooses these medications based on how much pressure reduction is needed in your eye and how much your eye responds to the treatment. So there are some side effects, though. Because these medications are applied directly to the eye, some side effects are pretty common. One of the most frequent side effect is eye redness, which is sometimes called conjunctival hyperemia. So the white part of the eye may appear pink or bloodshot. This can happen because some drops increase blood flow in the tiny blood vessels on the surface of the eye. Another common experience is burning or stinging when the drops are applied. Many people feel a brief stinging sensation right after the drop goes in. For most patients, this lasts only a few seconds, but occasionally it may last a little longer. Some people experience eye dryness, grittiness, irritation, almost like a feeling of having something in the eye. And this can happen because certain medications or preservatives are in the drops, and those can affect the tear film on the surface of your eye. Another side effect that some patients notice is blurred vision for a short period after applying the drop. This usually clears fairly quickly as the medication spreads across the surface of the eye. Some drops, particularly prostaglandin analogs, may cause changes in eyelash growth, making your eyelashes longer, thicker, or darker over time. And some patients really like this, especially the female patients. Some people also notice darkening of the iris, which is the color part of the eye, especially in lighter colored eyes like blue or green eyes, which can happen gradually with long term use. Another thing some patients notice is darkening of the skin around the eyelid. So you may see some darkening or mild puffiness around the eyelid area. Certain drops can also cause increased tearing or watering eyes, while others may cause the opposite, a feeling of dryness. Beta blocker drops, such as timolol, can sometimes cause systemic side effects, meaning they affect parts of the body beyond the eye. For some patients, this might include fatigue, dizziness, slow heart rate, or shortness of breath. And that's why doctors review your overall health history carefully before prescribing them. It's important to remember that not everyone experiences these side effects, and many people tolerate glaucoma medications very well. But if you do experience them, it's helpful to know that these reactions are relatively common and often manageable. The good news is that there are often ways to make glaucoma drops more comfortable. One simple strategy is to close your eyes gently for about 1 minute after applying the drop. This allows the medication to absorb into the eye and reduces how much drains into the tear duct. Some doctors also recommend what's called punctal occlusion, which means gently pressing the inner corner of the eye for a short period of time after applying the drop. So, what you want to do is just close your eye, take your finger and lightly press right by your nose. Keep your eye closed and breathe normally. You don't want to press the actual eyeball, just the inner part of the eye right by the nose. This can help reduce systemic absorption of the medication. Using preservative free artificial tears during the day may also help relieve dryness or irritation caused by glaucoma medications. Just talk to your doctor because they most likely have samples of artificial tears that you can try. Another tip is to wait several minutes between different drops if you're using more than one medication. It's common for doctors to tell you to wait 3 to 5 minutes between the drops. This allows each drop to be absorbed properly, and sometimes the bottle itself can be part of the challenge. So, learning comfortable drop installation techniques can make a big difference. So, ask your doctor if you need help on how to apply your medication. One of the most important things I want people to remember is this: you don't have to silently tolerate these side effects. There are many glaucoma medications available today. If a particular drop causes discomfort or side effects that interfere with your daily life, your doctor may be able to adjust the dosage, switch to another medication in the same class, try a different class of medication, or prescribe a combination drop. Glaucoma treatment is very individualized. Doctors often work with patients to find the medication plan that controls pressure while also being tolerable long term. Communication with your doctor is very important in that process. So, consistency still matters and will matter throughout your whole life while dealing with glaucoma. Even when drops cause mild side effects, consistency with your treatment is still extremely important. Glaucoma management is really about protecting the optic nerve over time. Skipping drops or stopping medication without discussing it with your doctor can allow eye pressure to rise again, and that is not good for your optic nerve or your vision. So if something feels uncomfortable, The best approach is to talk with your doctor about it rather than stopping treatment on your own. Most of the time, there are solutions. Glaucoma eye drops play an important role in managing eye pressure and protecting the optic nerve. But side effects can happen, and it's important to know that you are not alone if you experience them. Understanding the different types of drops, how they work, and ways to reduce irritation can make treatment feel much more manageable. And remember, your doctor has options, and glaucoma care is very much a partnership between you and your doctor. Thank you for listening to Field of Vision with me, Nikki D. If this episode helped you better understand glaucoma medication, consider following our podcast, sharing it, liking it, subscribing to it, so you don't miss any future conversations about living with glaucoma. Thanks for joining me, and we'll talk again soon.